Hello and welcome to our special broadcast, the debut of Times Fact India Outbreak Report. The only report on coronavirus which will tell you where India is headed in next 2 weeks. Which are the states which need to extend the lockdown? What has been the impact of this lockdown on various state and the economy on an aggregate level? How exactly are Indian states, hospitals and our tertiary sector really prepared to fight the coronavirus? So over the next 2 hours, a range of topics we would be discussing on where the numbers are headed, what is the level of state finances, which states currently need to work more closely on the entire medical chain, and which states currently do have to rethink the economic planning looking at the state finances. So Tamanna, this is a special broadcast, and next 2 hours we would be discussing, debating, dissecting and I guess analyzing lots of medical and economic scenarios.
Absolutely, Nukunj. In fact, any person who joins us right now will see a range of views. Let's set the context for you though. The Times Fact India Outbreak Report, along with Protivity, puts together an analysis and a projection of the coronavirus impacting India. It gives us a sense of how long it will take to return to quote unquote a normal kind of situation, by when we will see cases petering out. Of course, here at ET Now, we always look at how this will impact various sectors, impact the economy, and we will also be taking a very close look at the medical infrastructure in our country, a point which has been highlighted by the COVID-19 pandemic, which has impacted the entire world. So let's just take you through 3 key findings before we introduce our guests and start the discussion as per the Times Fact India Outbreak Report. Remember, these are projections based on 6 different models. It's an average of 6 different models which looks at where cases in India could reach. So as per these projections, by the 3rd of May, which is when the second phase of lockdown or lockdown 2.0 is expected to end, we could be looking at 38,534 cases. By the 8th of May, we could be looking at 46,819 cases, while on the 14th of May, we could be looking at 65,601 cases nationwide. These are now a total number of cases. Let's go across now to Dhruvata Ghosh of Protivity, the agency that has helped the Times Network put this report together, and of course looked at the different models which we're looking at. So we will go to Dhruvata in just a second from now, but I also have with me Hemant Thakkar, Dr. Hemant Thakkar, one of the best medical experts. And Dr. Hemant Thakkar will go into the numbers in a little bit of detail, but just your own assessment right now of how the numbers are headed as India enters this extended period of lockdown. We've increased our testing, we've increased our contact tracing abilities. Does it look like we will be able to control the numbers on the lower end?
Well, we've certainly done what we could do best, and that is increase the number of testing, and after tracing those people where we have got infections, we try to contain them. So testing, tracing, containment, and in the containment, we've become quite strict. We've seen to it that nothing leaks out, and we are hoping that if this containment succeeds, the curve will flatten. The flattening of the curve doesn't mean that the number of cases will not increase. The more you test, the more infections you're going to detect. But the ratio between positive cases, mortality and morbidity will start coming down. You might have positive cases, but they may not need hospitalization. You may have symptomatic patients, but they may not need ICUs. And the real definition of the curve flattening would be when the number of cases that can erupt from one infected individual comes down. where you do not see that one individual can infect 8 to 10 to 20, or even some people hypothetically said 400 cases. So you have to dilute the virus. And how do you know that the virus is getting diluted? You know that the virus is getting diluted when you see more number of patients testing positive with no history of symptoms. And the speed of testing positive should go down if you have contained them. So you gradually release those cases into the population. You know, it's like eating a large, big mirchi, a red capsicum, which is spicy. If one person were to eat it, he would choke and probably die. But if you crush that capsicum or red paprika into small pieces and distribute it all over the community, the little pieces of capsicum would be digestible, would be eatable, and would not affect the population. So containment and mild lockdown release over a period of time would help decrease the virulence of the virus, would help increase the herd immunity and our ability to take the virus into our immune system and into our gatefold. If you ask me, when are we going to peak? I think we are in a cinema hall where the interval may have just started and we have a lot of film still to see. We don't know if we suddenly break down this lockdown and we have a surge of people all over the country coming out and cross-mixing, we could then go the Italy way or the New York way. We only rely upon the fact that Indians are tough and we have a different genotype and phenotype and BCG and blah, blah, blah. We have to take the precaution. We are moving in the right direction. The graphs epidemiologically are not wrong. We are a huge 1.3 billion population. We are going to increase our numbers. What remains to be seen is not numbers alone. What needs to be seen is whether these numbers are going to translate into hospitalization, are going to translate into ventilator requirement, are going to put a great strain on the medical system. My COVID warriors are working hard, and COVID warriors doesn't mean doctors and nurses. It's the municipality, the police, the traffic, the people who are good. You know, what is courage? Courage is not being not frightened, but courage is knowing that you are afraid, but still doing what you are supposed to do despite being afraid. And this courage is what I am appreciating. It's been a good month. We are into this, and we are going to be into this for as long as it's required, because it's a small investment in a few weeks for a translation into a good, long, healthy, happy life. And that's what I would say to initiate this conversation.
I think that's a complete endorsement, Dr. Hemant here, the fact that lockdown has worked, but the projections are indicating that the lockdown till 3rd of May may not be enough, especially in Maharashtra, Tamil Nadu, parts of North India, where the spread so far is not getting contained. So one goes by the projections, and these are various models which Protivity has done. Based on the average assumption, I guess we are nowhere close to peaking out, and the peaking out may actually happen same time next month. How scary is that? And do you think one should get worried about the fact that projections are indicating that we've not peaked out despite a 4-week lockdown?
Definitely. It is scary. We need to worry about the fact that our numbers are going to spiral. But if these numbers go up gradually, they grow up slowly, and we contain them, then we don't have to worry. For the simple reason that they will be treatable, controllable. They will not need, like I said, a drain of intravenous medication, excessive nursing, excessive doctors. But one does not know. If the summer turns against us, if civil disobedience steps in, if people take law into their hands and change this disciplined environment, then we could be in trouble. We should not be lulled into complacency, thinking that we are on the right track and that we don't need to worry. I'm hoping that this game changer virus forever changes the way we live. Spitting, gutka, pan, those saffron stains outside every elevator, every corner should be banned, should be fined, should be imprisoned. Hygiene, cleanliness, I think masks are here to stay. We can forget spending money on cosmetic and lipsticks. We need to wear the mask. Social distancing, even banks, even restaurants, they all will have to follow social distancing. The airlines have already started selling alternate seats. So social distancing, hygiene, hand sanitizers, everything is here to stay. Remember, what began with corona will probably change our life. We used to boil our needles 25, 30, 40 years ago and reuse them. Then we came to disposable needles. The family planning invented the condom for controlling families. Then it has taken up a new role, and that is to prevent HIV. So by the same way, corona is going to be a hygiene game changer, is going to teach us not to cough in public, not to sneeze in public, not to discharge in public, and is going to teach us to love our home, to not unnecessarily go out and congregate. If you have to flock together, it is at a distance. Your close, near and dear ones are extremely invaluable. You don't have to congregate in large places to celebrate, to have fun, to even pray or to have any religious ceremony. This is going to change in the times to come.
So, very interesting perspective there about the new normal that we will see. The question is when it will kick in, because that point of when we start petering out on the number of cases will impact a lot of factors. It not only will impact the health of people, the phasing out of the lockdown, but also the economic scenario in very large ways. So I want to welcome now Siddharth Sanyal, Chief Economist and Head Research of Bandhan Bank. Mr. Sanyal, great to have you on this mega broadcast. Just to get your perspective, if we see a number of cases peaking post 3rd of May, and this seems like a possible scenario based on 6 different kind of projections and methods that have been used in this research that we have seen and which we are presenting today. What does this mean for the return to productivity, to return to economic activity?
Well, it's extremely important at this moment or the last few weeks what we have seen, that we have attached, and rightly so, a priority to saving people's life at this juncture, taken a very, very cautious stance at this moment. But at some point of time in a country like ours, you have to strike some kind of a balance between life and livelihood. And to some extent, even though the disease is far from coming under complete control, you have to explore a few possibilities or a few areas geographically or in some other way that where you can actually bring back some kind of economic activities to help people. So basically, what we are relying upon at this moment, my sense is that the red, green, amber classification that the government has come out with, that will remain in force for a pretty long period of time, because as we can find out that even though the lockdown currently will likely get lifted from 3rd May onwards, there are certain pockets in this country, and economically extremely important pockets such as Mumbai and all, where the spread of the disease is much more rampant than what we had anticipated a few weeks back. So in this kind of a situation, most probably what we'll be seeing, that you might actually see continued lockdown in some of the pockets, but at the same time, in some of the districts, some of the pockets, some areas, you might actually see some phase relaxation. And there, you might actually see some bit of relaxation in possibly in the rural segment, rural areas of the country, where the spread of the disease is relatively better under control, the social distancing, etc., with a bit of awareness, spreading in the hinterlands might be slightly easier over a period of time. So my sense is that you will be seeing that over the course of the next few weeks, and that's the way to go back to normalcy in a very phased and staggered way, because you cannot go back to normalcy all of a sudden, but at the same time you cannot keep a lockdown kind of a situation for a completely indefinite period of time as well.
Okay. Now I'm going to again go back to the impact state-wise, and here's what we've managed to look at, and the state-wise GDP contribution, which perhaps is going to be very large. States where the COVID is not showing any signs of peaking out. That starts with Maharashtra, which accounts for nearly 15% of the total GDP contribution. Tamil Nadu stands at a neat 10%. For Telangana, the number is 4.5%, and for Uttar Pradesh, it is in single digit, but it's a large state to reckon with when it comes to the immigrant population and when it comes to the demand side of the equation. Dr. Hemant, my next follow-up question is, states where we know that where definitely there is a problem, and in cities like Mumbai and cities like Delhi, we are nowhere close to peaking out. Is it safe and logical to assume that even if lockdown is removed on an all India basis, partial lockdown in some of these affected states will continue? Now, economically, I may argue that, okay, Maharashtra is a big state, Tamil Nadu is a big state, Delhi is a core state, but you have to pay the price. Right now, economy does not matter, and that's the right way. Even though these are progressive states and large contributor states, the chances of a partial lift down in some of these states is going to still happen.
So we are on ET now, and I'm now going to give our viewers an ET shock, extraterrestrial shock. Remember, this virus is going to finally get to all of us. Me, you, everybody is going to test positive sooner than later the moment we get out into the population. That's the only way we will develop immunity. Now, your question about states like Maharashtra, Delhi, and the others, I fully agree with you. And this is where I think we need to use a carrot and stick approach. If the states, if the people living in the states are shown that the light at the end of your tunnel is very far away, and you need to behave, and you need to toe the line, at least they will discipline themselves a little more. And just now, I can see that if in Maharashtra, we prematurely lift the lockdown until in the next 14, 15 days, we see some improvement, there will be a splash of cases. We have migrant labor, we have slums, we have people coming in from all parts of the world who have already come in. And we have an anonymous virus whose credentials we really don't know much about. We're learning every day. What began as a respiratory virus now affects the gastric system, affects the heart. It can have all sorts of presentations. So one will have to really sit at night with the midnight oil and juggle all the figures before lifting the lockdown. And even if the lockdown is lifted in certain quarters, in certain slums, I'm afraid for their good, more than the good of others, which is also important, the good of the community, for their good, it is extremely important, because especially in those pockets, the hospitals are sparse, medical services may not be enough. So we will have to be very careful. And as you rightly said, we are finally going to decide as health over wealth. And health being the real wealth, economy and all the contributors of GDP will have to take a back seat, while the health of the population is more important. I agree with you.
Okay, I want to welcome on to this special broadcast Sanjeev Sanyal, Principal Economic Advisor, Ministry of Finance, of course, Government of India. Mr. Sanyal, welcome and thank you for speaking with us here on ET Now on our mega broadcast, where we're talking about when we will peak possibly, and of course the impact that will have on economic activity. I want to start by getting your point of view on the economic side of things, keeping in mind that health is of course the topmost priority, as it should be. But can we look now at a larger lift in phases of the lockdown so that we preserve economic activity?
I think I would agree with the previous speaker that this has to be seen first and foremost as a medical emergency. I think the Prime Minister has made that point as well. And that if we don't take care of that first, we really can't get the economy going as well. Even from a purely economic perspective, the health issue has to be taken into account, because obviously we can't open up the economy if this keeps spiraling out. So I think don't separate the two. The health issue is absolutely important. However, having said that, obviously livelihoods matter, the economy matters, and of course, in the longer term, we still need to take care of other diseases. We need to take care of food issues, livelihood issues, and so on. So as time passes, the economy and its requirements will begin to become very important. So the approach we have taken, which is somewhat different from many other countries, is not to come up with one big bang package for the economy. Instead, we have taken a more calibrated approach, a step-by-step approach. We, at every stage, take into account the requirements at that time and are delivering medium-sized packages, one of which you got today from the RBI. Let me assure all viewers that we remain committed to doing what it needs, but we will do it through a feedback loop approach, by which we deliver these in a more calibrated way than maybe other countries have, and maybe some people would prefer it the other way.
Well, I go back to the projections once again, just for the benefit of our viewers, and we want to just once again reiterate the fact for the benefit of our viewers that it is on us, viewers. If we maintain social distancing, if we honor the lockdown, we will be able to see back of this coronavirus. Now, these are projections which have been done scientifically on various models, and those projections and those numbers will just come up once again. Mr. Sanyal, my immediate follow-up question is that I'm doing a relative comparison here, and I'm comparing what other developed countries and other countries so far have spent in terms of fiscal stimulus package as percentage of GDP. India's number so far is nowhere close to what other countries have done. Why is that? And is that the wrong way of looking at things?
It's completely the wrong way of doing it. That is why we have been telling you throughout, and I'm reiterating it here, that we have not gone for the Big Bang approach. Now, it is not because we do not have fiscal and monetary space or we are unwilling to do it. It's because we have gone for a much more calibrated approach towards it. So we will do medium-sized packages, and we will keep doing lots of them as it goes through. Now, why are we taking this approach? The reason we are doing it is because we are dealing with an evolving and very uncertain situation. So instead of firing all our bullets right up front and wasting a significant amount of it, we have taken the call that we will take the resources, we have lots of it, but it's still limited, and try and put it where it needs at every stage. So we are putting in a lot of effort. And by the way, even these packages we are doing are not small. I mean, they are running into lakhs of crores, incidentally. So these are not small packages. But if you just happen to take any one of them and compare it to some of the mega packages of some other countries, it may appear small. But you will see as we accumulate these packages, they will become a very significant push. And I think the rest of the world, by and large, is slowly beginning to come to our line of thought, because we, as you may be aware, have just signed a G20 action plan for a global response to this economic and health situation. And in that document, if you read it, you will see that it is also very much in line with our feedback-based step-by-step approach. So even countries that have taken a big bang approach to start with are beginning to now veer to our approach.
Now, if I do a state-wise analysis, Mr. Sanyal, some states have taken a hard hit. Maharashtra, Tamil Nadu, Delhi. These are large contributors to India's GDP. Whereas the center has to manage the entire country, state-wise, the impact of COVID is going to be very differentiating, especially in places like Maharashtra, where the auto manufacturing belt is there. Chennai and parts of Tamil Nadu, where again manufacturing activity is very large. Is there a plan to have a differentiated approach, especially at the state level, looking at the crisis and the impact of the medical crisis? And is that a good idea to have?
Well, there will have to be, at some level, some differentiation, not just by geography. You'll also have to think by sector. But to start with, you have to take into account the fact that the entire system has been affected. And we will have to take care of the whole system to start with. Because remember, this is an evolving situation. Today, a particular sector or province may be affected more. Tomorrow, it may be a different one. So at this juncture, we have to take a somewhat more broad brush approach. Having said that, there are certain areas, sectors, etc., that we may want to put a little more effort. Now, one example of that is the financial system. The financial system is like the circulatory system of the human body. It's what takes oxygen to every part of the body. So if the circulatory system backs up for whatever reason, then you will have a serious problem in the entire economy. All sectors will be affected. I mean, you'll begin to have cascading defaults. Companies across the board will not get credit. Payments won't happen, and so on. So there are certain areas where we will have to pay special attention. And I said I give you one example of the financial system where we are currently paying a lot of attention. The similar approach differentiated approach may have to be taken for states as well. And of course, some of these states have resources of their own which they need to deploy as well.
Mr. Sanyal, if I can just come back to the package, and you're right, India has been taking a calibrated approach, but some may argue that especially our informal businesses, our small and medium businesses, needed much more substantial support earlier in the day. One common demand we keep hearing is deferring of GST payments, some kind of wage support. Do you think we will see something pretty soon focused on this?
So let me say that we are aware of these issues and certain measures are being put in place. Now, obviously, it is not for me to announce them. That is the prerogative of the finance minister. But let's say measures will be announced sooner rather than later. I think the finance minister is fully cognizant of these issues that you have just raised.
If I may just come in with what the governor said today, Shaktikanta Das, RBI governor, talked today about returning to a 7.4% growth in 2021-2022. Do you see that as an optimistic projection? How do you think that will come true?
I think he was quoting, if I remember correctly, the IMF's projections. I don't think it is the Reserve Bank's projections, but nevertheless, it's entirely possible we will go back to a higher growth rate. Particularly next year, we will have the advantage of a low base as well. But at this juncture, the focus of our approach is to cushion the current downturn and try and protect as much of our economic system, particularly the SMEs, from the current situation. So we have not yet begun to lay out the path to reconstruction. And so that is something we will come to. Our focus right now is on cushioning the downturn. And of course, longer term, we will have to go back to the other issue. Now, let me say in this context an important thing. When we go into the reconstruction mode, remember that it is not obvious that we will be going back to the pre-COVID world. The world we will live in will have different geopolitics. It will have different socio-economic and consumer behavior. It will have different supply chains. So it will have a different logic. Even technologies will perhaps move on. So we have to be clear that we do not simply attempt to go back to where we were before the crisis. We will have to move forward. And I think in this environment, we will have, we as a country, not just as a government, but as a country, will have to take a much more active role in engaging with the world. In the sense that we cannot go back there and say, this is how it used to be, and, we will try and do a little bit on the edge change. No, the rules of that world will be different, but there is an opportunity here for India to be a part of writing the new rules. So that is something very important. We need to take this whole thing in a much more risk-taking approach than historically India has been in our engagement with the world.
I agree with you, sir, that when the equilibrium changes, let's find opportunity rather than looking at threat. But Mr. Sanyal, let me address my last question to you, and more like a near-term dominated question. Government is saying don't fire. Companies are saying we have no option because we have debt, we have interest to pay, we have no revenue. What can we do? What is the plan to save jobs?
So obviously, the first plan, as I said, at this juncture, is about the cushioning. So that is where, of course, liquidity is being put through, various kinds of moratoria have been put through. We understand that even with that, it is not going to be easy, particularly for the informal informal jobs, self-employed people. We fully agree with that. But as I said, our focus is on cushioning it and dealing with first cushioning the economic impact and dealing first and foremost with the medical emergency that we have. Once we are past that, and I would argue that we have done better than most people would have given us credit for, we will probably be, and fingers crossed here, we will probably be out of this cycle before much of the world. In which case we need to, at that point, go very quickly into rebuild phase, because we need to reinflate the system as quickly as possible. We fully agree that if we sort of just stabilize there, then all the problems you just mentioned will begin to creep up. We can't go back to a sort of looking for equilibrium on the other side of this. We have got to reinflate the system, try and trigger self-sustaining positive feedback loops and so on.
Absolutely. Fingers crossed, fingers and toes crossed that we peak out and then move to reinflate the economy, as Mr. Sanyal has said. We'll take a very short break while, of course, keeping an eye on when that economic package is coming. Will we see some activity this weekend? That's a larger question. But remember, you're watching the Times Network mega coverage right here, where we're talking about projections. When will we peak? When will we see supposedly, phase lift of the lockdown, and how prepared are we? All of those aspects coming up. We have a great lineup of speakers for you. Come back after this very short break.
Kerala has become an example of how policy can perhaps find a way to flatten the curve, as they call it, with lesser and lesser cases being reported. Remember, the first cases of COVID-19 in India were from Kerala. So what is the formula that has been used by the state of Kerala? I have with me now Mr. Thomas Isaac, of course, the finance minister of the state of Kerala. Mr. Isaac, thank you so much for speaking with us. Let me begin by asking you very simply how Kerala seems to have, at this point, managed to flatten the curve.
Well, suppose we had failed to do that, I think I can only imagine what would have happened in the state. Suppose the number of cases were doubling every 4 days, as was the situation in the first weeks of March. By this weekend or early next week, we would have had something like 50, 60,000 patients, of whom at least 1/3 would be critical and far outnumbering the ICU beds that we can spare, and it would have been a calamity. Now that means it has not happened. Okay, it is not going to happen. The normal mathematical models, we have been doing that. It all shows where would have landed up. Our intervention has helped to diffuse this crisis, and saved so many lives. This is happening in India also in a smaller scale. In many states, the numbers are not climbing exponentially, coming down. It's a positive thing. So it means that the way you intervene can have very positive impact, not laissez-faire attitude. We have to consciously intervene. Now, how did Kerala intervene? Just without taking too much time. One, we have a health system of which we are very proud, which is our historical legacy. I don't say it's my government creation. It's a historical legacy, which I think we are not doing enough in the rest of India. Every day, a public health system is being undermined, various schemes of insurance and so on. They're all good, but with the base of a public health system. That's one. Two, we were prepared. The moment you heard about the outbreak in China, well, alarm bells rang. We had our control room. We had groups in every district, mock drills, and so on. So we were ready when the Wuhan students returned. Not a single secondary infection from that influx. But then things got out of hand, the second stage. And because many people took it lightly and would dodge the restrictions and so on, finally we had a kind of doubt where we are going. As I told you, it was going up exponentially. Therefore, an intensive drive for tracing every contact of the patient for the last 2 weeks, testing every one of them, putting every one of them under observation. If anybody proves to be positive, once again, one more round, round, till, well, the chain is broken. And three is social distancing and, new styles of, the break the chain campaign. It was very successful. People adopted the campaign, and that also helped a lot. And I'd say, importantly, finally, we rolled out a relief program also. Let me a package for relief, putting money into the hands of people, and that with the local governments and so on. So these were the factors.
Mr. Thomas, if I may ask you, was it also helpful? Because if we look at some of the worst hit parts of the country, they happen to be the big crowded cities, Mumbai, Delhi. Was it also helpful that, there is no city like that intensely crowded in the state of Kerala, where there are such a large number of people living in close quarters?
No, Kerala has the highest density in India. And we call Kerala a big town. If you have traveled in Kerala, you must have understood the kind of settlement.
I mean, compared to a city like Mumbai, for example.
But nothing to
large, a slum like Dharavi.
But, there is no much difference between city and rural areas. It's a stretch, continuous ribbon-like stretch of households. And therefore, we have to be very careful. It's not just one hotspot. Anywhere it can be there. So I don't think that was much of a difference. But is that there is a population that responds to what government says. And that's very, very important. That receptivity is much higher in Kerala. Let me say, the kind of synergy between the government policy and local initiative is very high in Kerala. And that helps. Government cannot go and stretch and watch every nook and corner of Kerala. But our local governments, organizations, and so on, they do help.
May I ask you what you see as the challenges coming up ahead? In different parts of the world, we have seen second waves coming. And is there a plan for a phased exit from the lockdown now and the end of 3rd of May? Because that will be the next big challenge.
Currently, we are facing two challenges. One is a planned exit to revive the economy. Two, we have to revive the economy while COVID still continues. COVID is not going to leave us. Our dreaded moment is that when lockdown is over, hundreds of thousands of persons are going to come back to Kerala. It is a homeland. And we have to provide for them, take care of them. Even if they're sick, they have to come back to Kerala. We'll take care of them. But the numbers are huge, maybe 200, 300,000 persons. So we are preparing to quarantine them. Only 2.5 lakh beds have been identified in various places. They are being monitored and so on. And we, thirdly, in such a situation, large number of people are coming back and you don't know the morbidity among them. And then you are also opening up the economy. So what is a strategy at that time? We are going to follow a strategy of reverse quarantining. That is all the vulnerable sections above 60 who have special health conditions. That would come to, I think, something like 20% of our population. They would have to stay indoors, strict. They are indoors. Healthy people, even if they get contaminated, etc., they will go out to work. Okay. So we have to provide for this 20% who are staying in the house, their healthcare. Many of them would require food and special attention and so on and so forth. So we are preparing for this. I hope everybody, as you said, has noticed how we are flattening the curve. But I hope we will also be able to set an example. How do we exit from this lockdown? And that's the challenge.
Absolutely. That was the Kerala model that everyone is talking about. We'll take a very short break. When we come back, focus back on industry, and we're coming back with the biggest names in the auto sector, a sector which was beleaguered even before COVID-19 hit. On the other side, you will hear the top bosses of M&M, of Maruti and Eicher Motors. Don't go away. Welcome back. You're watching our mega coverage on ET Now, where we're talking about data which would show when we may peak in the coronavirus pandemic. And of course, being ET Now, we're talking about the economic impact this will have on various sectors. Now, the auto sector was beleaguered even before the COVID-19 crisis hit the world over. The transition from BS4 to BS6 was a sore point with the auto industry even before the lockdown got into place. What does the future look like? Here are some of the top voices in the auto industry. We have with us MD of Mahindra & Mahindra, Pavan Goenka, CEO of Royal Enfield, Vinod Dasari, and Chairman of Maruti Suzuki, RC Bhargav. Take a listen.
Well, clearly, during the lockdown period, there was no manufacturing, as we know, and all the dealerships were shut down, so there was no selling either. And therefore, I would say for the auto and tractor business, at least everything was on standstill as far as manufacturing and selling is concerned, but everything else was going on in terms of product development, all the other planning, budgeting, all the other activities were on, but no manufacturing and selling. Now, post or lockdown 2.0, if you call it, which started on 15th of April, as we know that from 20th April, there'll be some relaxation that will happen on some of the activities across India in the non-containment zone. We're still trying to figure out precisely what will be allowed and not allowed. Clearly, Mahindra will ensure that whatever we do not compromise with the health and safety of our employees or anybody who we're doing business with, and therefore we'll be very careful in opening anything that we open. But as it looks right now, some of the tractor plants which are not in containment zone will be allowed to open. Some of the dealerships will be allowed to open. That will then allow us to, on the tractor side, that will then allow us to clear the inventory that we had in the pipeline and perhaps putting few more tractors into the market. So that to that extent, I think business.
The first phase of the lockdown and now the partial lifting of lockdown. Looks like we are headed towards a partial lift down of lockdown. How do you think that will change the auto sector and the company you represent?
I think from a personal level, what I've asked all the employees to do yesterday is to think about all the things that we accomplished during the lockdown, which you would have otherwise not done personally. And what are all the things we regret not having done during the lockdown? So what we regret not having done becomes like an action plan for lockdown 2.0. But more specifically, as far as the company in the auto industry, I think a partial lifting will hopefully restart the juices for the supply chain.
First, let me get a reaction going from you, Mr. Bhargav, on partial lockdown. What is your understanding now that some guidelines have been released? Are you in a position to start some of your plants based on the lockdown guidelines?
You know, we are still studying these guidelines. The main issue is that starting our own undertaking, our own factories is not good enough. We need to make sure that all parts and components which are required for a car are available, which means all our vendors must be functioning anywhere in the country. Now, to the best of our information and knowledge, that is not likely to happen because several of the vendors may be in the containment zones once they are announced. So that will be one issue. We have also to see exactly how this will work on the retailing of the cars, and that also is not very clear. We need to study that a little bit more. But if we can get all the components that we need by finding alternative sources, and if we can get the retail going, then I think we have all our systems in place for starting production.
Okay. If one works with the assumption that the lockdown will be lifted in the month of May, can I assume that in the month of May it will take at least 2 to 3 weeks for Maruti to resume normal production because of the factors you mentioned in terms of component availability and supplier and raw material availability?
You know, even when the lockdown is lifted on the 3rd of May, we still don't know what would be the position in the red zones and whether production can start without restrictions in a red zone seems to me very unlikely, besides the fact of being very risky. So
you're watching this mega coverage on ET Now, the Times Fact Report, where we are talking about and tracking the COVID-19 pandemic with data, with research, and talking about when we can see this petering out. These are projections based on 6 different kinds of surveys, an average of them. And one very important aspect of these projections is the medical infrastructure we need. Now, as more and more people possibly will be infected by COVID-19 even after the 3rd of May, the question will be, do we have the infrastructure to treat everyone the way they need to be? That will be essential even in reducing mortality rates from where they are. So just a few figures for you. Out of the total beds of India, already 40 to 45% are occupied. As per the survey, only 78 people will have ICU beds for every 1 million of the susceptible population. How do we increase, how do we scale this up very, very quickly is the question. And to speak on this aspect, we have with us now Dr. S. Narayani, Zonal Director of Fortis Hospitals, and Dr. Praveen Gedan, Additional CEO of Ayushman Bharat. Remember, under the Ayushman Bharat scheme, COVID-19 treatment is now free for the percentage of the population that is eligible for this scheme. They also are impaneling private hospitals for the same. Welcome to both of you. Dr. Narayani, I want to just begin, with your first take on some of the findings of our survey, which point to an acute shortage of beds in ICU and equipment if we reach our peak.
So I have this to say that I see your survey and see your numbers. But I think the issue is really not that serious, and I don't think we're going to have such a shortage of ICU beds. I think I would put it in perspective by saying that, first of all, we need to remember that only about 15 to 20% of those patients who test positive really need a critical care bed, number one. And number two, we do have the kind of critical care beds to cater to them. Probably what we have is that these are in multiple segments and they are fragmented and spread across multiple hospitals rather than having it all together in one place. So that, to my mind, there are beds available. Secondly, every day the situation is dynamic and there is a lot of activity which is going on by various health authorities and the doctor groups coming together to redefine who are the patients who need to be in an ICU bed in a hospital. And so they are vacating these beds with newer protocols. They are moving patients around faster and keeping patients who don't need a critical care bed being moved out faster. So to my mind, the situation is not so bleak.
Okay. I'm coming to you in a second, Praveen, with my next question, but just a follow-up question, Dr. Narayani. If one goes by global experience, there has been a shortage. I understand the virus right now it has not spread like what it has done in Europe and US. But when you say confidently that there is no shortage of ICU beds, are you speaking about your experience at Fortis or what private hospitals have, or that was a comment based on our total availability on India basis?
So I'm more specifically speaking about Mumbai. So I'm working out of Mumbai. I'm not speaking just for Fortis. And if we see in the city of Mumbai, the health agencies are working as a public-private partnership where the private hospitals are working along with the public hospitals. And the way things are moving, there is, I think I would say the experience is that more and more beds are being put into commission, number one. So the beds are there is a pipeline of beds which is getting available. And additionally, there is also the guidelines which say whether a patient needs to be in a critical care bed is constantly being looked at with better treatment protocols coming up, which vacates the bed a patient is occupying faster. So in that sense, I would say that the number of patients who the critical care beds would be available. And we must keep in mind when we look at the data that in countries abroad, there is this factor of the demographic age group of the patients, as a result of which there are more number of patients in the older age group. So your more critically affected patients are much higher than what would be the case in India.
You know, there was a report just a couple of days ago of a COVID-19 patient, a woman who had to wait 30 hours in a parking lot of a Mumbai hospital just to get admitted in. Part of that report, of course, talked about the lack of coordination of the local authorities to where the beds were actually available. Let me take the question to Dr. Praveen from a pan-India perspective, and especially outside metro cities. The situation is such that there are more beds available in cities where the number of cases are higher, but the moment you go out and you go to tier 2, tier 3 cities, rural areas, the medical facilities start thinning out. How are we preparing to have people treated in these areas if the situation so emerges?
Okay. Firstly, I just like to clarify that I'm not gone through the report which you are just referring to, but yes, coming to the point of availability of infrastructure as a whole for patients from metros to countryside, especially particularly 2 and 3, the general trend has been to take care of the patients in government facilities spread all over. Mostly it is district hospitals, civil hospitals, or local medical colleges of the government. And as of now, the government has been managing it well. Now, I hope it doesn't, the situation doesn't arise. But let us presume if things go very bad, which it should not, I hope. We in government have a backup plan ready to use the facilities available in Ayushman Bharat. Now, Ayushman Bharat itself has a network of 21,000 hospitals, which is a big number, out of which 9,000 are private hospitals. So there are two ways by which this can be done. When we are talking about availability of beds for COVID cases, you may remember that now we are treating patients either in the hospitals are getting converted into COVID hospitals. So generally COVID is being treated separately in a separate hospital or a separate block. This may lead to a situation where non-COVID patients may also find it slightly difficult. So this Ayushman Bharat can chip in by providing an alternative facility free of cost to COVID as well as non-COVID patients. This will further augment the availability of beds or infrastructure in general, which in fact right now appears to be sufficient one.
Dr. Praveen, just a follow-up question in terms of equipment as well. The world over, we are seeing COVID-19 patients and some of the extreme ones needing a larger number of ventilators, dialysis machines in some cases. And we know that the private sector is also now coming up with ways to create ventilators faster at cheaper cost. But what about the time lag between the number of cases, bunching up and all of this equipment becoming available? Is that an area of concern?
It is exactly this reason that we are right now in a lockdown to suppress or flatten that curve so that this bunching up doesn't happen. This bunching up has happened in many developed countries with far better medical healthcare infrastructure than India and has led to certain crises. And India has been managing it from not only clinical point of view to treat the patient per se, but from public health point of view and preventive health point of view by ensuring that the cases are spread over time, temporal distribution. So this is one strategy which India has been following successfully so far, better than many other countries. This is one. Part two, at the same time, government has invoked special provisions of acquiring medical or procuring medical equipments in a fast track mode, bypassing the routine processes which are time consuming. And I hope industry is also trying its best to match with the adequate supply. As of now, this has not happened, and I think the planning is like that, and also hope that this situation doesn't arise.
Okay, I want to go back to the earlier part of the report. The report is projecting that we may be peaking in mid of May, and perhaps later in some states like Maharashtra, Tamil Nadu and some northern states where according to the average modeling what Probity has done, we've not really peaked out. But it is on you viewers, if you maintain social distancing, if you really respect the importance of this lockdown. I know it's hard, but it's important to maintain discipline. We at ET Now tell you how to convert your pennies into pounds. And this is a time when right now it is important to be safe and stay safe. You know, stock markets, yes, they may have fallen. Yes, economy will take a hit. Yes, corporate profit will take a hit. But the most critical thing in life is to stay alive. And social distancing is something which really has worked. I'm going to get the projections once again, but Dr. Narayani, I'm going to get a closing comment from you. As a doctor, why don't you re-emphasize the importance of social distancing? I'm sure right now you're dealing with people who are coming to you who may be psychologically devastated, who may not understand the importance of social distancing. Do you think lockdown, stroke social distancing so far is the only way out? Yes, we'll discover vaccine one day, we are hoping and praying, but today it's not been discovered.
Absolutely. Social distancing is the key. No panic is a second factor. While we understand social distancing, I think we must look at it with complete the logic behind why we're doing social distancing. There is an element of panic which is creeping in, making people feel that there is a stigma attached to this whole getting a COVID positive tag onto you. I think that too needs to go away. Entire society as well as individuals need to feel that it is like picking up any other infection. You just need to make sure that you keep your distance so that you don't contribute to the spread. So in addition to reinforcing your message about social distancing, I would like to say that there shouldn't be a stigma around being testing positive. People should come up voluntarily, and when they feel that there is a doubt in their minds that they could be COVID positive or they have some symptoms, they should come up, and this will largely and hugely contribute to quickly picking up cases and controlling the contacts and controlling the spread.
Dr. Praveen, hypothetically, if you look at the numbers here, how many hospital beds as we speak today are ready? How many beds currently have provisioning of a ventilator? And how many of these beds right now are ready to operate as we go live on national television? Dr. Praveen?
So this information imperfectly is not available with me right now, though it's with me in my laptop. But we have gone through that a few days ago, and as of now things are okay. We have enough beds in India, one. Two, as I told, we have a backup plan of roping in private hospitals in a big way ready. So this is a backup plan which will kick in when we run out of the capacities in public health care infrastructure.
Okay. Dr. Narayani, if I may come to you on the scenario post 3rd of May. Now, what part of this report predicts is what happens once the lockdown starts to lift. And the concern is, and the challenge really is, to make sure we don't suddenly have a jump up of cases. It's a fine balancing act because you can't stay in lockdown forever in all districts of the country, but the moment you move out, the risks go up. What are the kind of challenges the medical fraternity and the medical infrastructure in the country now have to be prepared for as we see a scenario develop post the 3rd of May, where there may be a partial lift in certain districts and as a consequence of that, an increase of cases?
Yeah, you're right. So we can't, post the 3rd of May, we can't suddenly feel that it's all back to normal and, lockdown goes away and people rush into get back to normalcy in terms of life. There has to be a high alert. And I am hoping that the lockdown and the changes in the social distancing will kind of go away only in faces, and I'm sure there would be measures to do a staged removal of the lockdown. The aspects of social distancing should continue. And I would also say that as, say, a medical practitioner and as hospitals, we will maintain a high level of suspicion and high level of our index of suspicion on who could still be a possible positive case would be high, and we would be screening for the same. Additionally, I would say that by then I hope we would have newer tests which help us to more rapidly pick up whether somebody has had an exposure or not. And we would also keep in mind that the number of asymptomatic positive cases may be walking into us. So some of the precautions, some of the measured way in which we have flow of patients, we would definitely continue. It's not as if we could stop some of these activities by the 3rd of May. And it will take us a while before we completely say that we can go back to normal. And so it's going to be in a staged manner that we come back to normalcy.
Dr. Praveen, I think one big lesson that people are talking about with COVID-19, the world over, not just in India, but in the Indian context, is that have we been paying less attention or neglecting the medical infrastructure in the country? And here is where, a scheme like Ayushman Bharat comes in. Fantastic, ambitious scheme about providing universal health care. But for that...
Well, thanks for staying with us. You're watching live coverage of the Times Fact Report, a report which is perhaps the only report on coronavirus which will tell you that how exactly India is likely to move. Are we prepared if the lockdown is extended? And what about state finances and how efficiently is our medical infrastructure ready? The report has some interesting findings. It's used various and different models, and the findings of those models will just come up on your screen. But the bottom line here is that we are nowhere close to a peak. Peak will happen in mid-May, and highly affected areas may roll over the peak into the month of June. So if India may see a partial lockdown, and if some states may not see a removal of lockdown, what about essential supplies? So far, companies like Amul, Parle, and other companies have done a great job in maintaining and ensuring that the milk supply, the biscuit supply, daily essential supplies are not compromised. But if the lockdown is extended, which is what the report is indicating, should you get worried about it? So I'm going to throw it open to Mayank and Mr. Sodhi. Gentlemen, good evening to you. Thank you for joining us. Mr. Sodhi, when we spoke to you first, when the lockdown was announced, you came on the channel and you said, don't worry, Amul is prepared and we will make sure that India does not run out of dairy supply. And you've managed to demonstrate that you are capable of keeping up your promise. But now, given that we are not peaking out in some key states and lockdown may be partially removed or it may not be removed, what is your preparedness?
Nikunji, let me tell you, when you talk about food or packed food or organized sector, there are three stakeholders. One is the farmer who is producing food. Second is the consumer, mainly in the urban center, who is consuming it. A third is the supply chain, which is connecting production with the. We are very lucky. I was hearing, whole industry in pessimism and mess, but food industry is lucky that because of 1.35 billion people who are consuming, whether at home or not. In fact, when at home, consumption has increased. So consumption has not gone down, so is the production. What was little bit happened was in the supply chain. Initially, if you talk about Amul, we have got three types of supply chain. One is for the fresh product where we distribute milk, buttermilk or dahi, and that was more or less in line, and we continue to supply right from day one or minute one when the lockdown is announced. Initially demand increased, then gone down, still increased 10 to 12% lower in the fresh product because of the Horeca sector closing down. For other segment is our dairy product, butter, cheese, ghee, milk powder, tetra milk, that is ambient and chilled product. That took some time to systemize. Within 2-3 days, it was online. And in fact, in most of the product categories, demand increased from 10 to 50%. I mean, today we are selling double the quantity of paneer, 50% more quantity of tetra milk, 20% more of milk powder, dairy whitener, butter, or ghee. Simply because people are sitting at home making more headache. Earlier, there used to be working breakfast, working lunch. Now everybody is having proper breakfast, proper lunch, and proper dinner. And dairy products are consumed in all the three meals, rather dessert also. So that is. The third category, which has been definitely impacted in Amul or dairy sector, is the ice creams. Because most of the shops are closed down for the ice cream parlor. So initially our sale was down by 95%. Now every day, whether you talk about ice cream or you talk about dairy product, every day is better than the yesterday. Every day sales are picking up. So what is happening is, it is not that everyday consumption is, consumption was already there, but pipeline got emptied. Distributor, retailer, and gradually as everything is falling in place, no doubt the window involved is very small. So we are filling up the pipeline. So how fast a company can fill up the pipeline and systemize that much? So let me assure you, demand has not gone down. Only pipeline is emptied. So if not today you're getting the demand, tomorrow you'll get the demand. No doubt there has been a lot of innovation in supply chain. If I tell you in case of Amul,
Mr. Siraj Hussain here. Right, fair point, Mr. Sondi. You know, it's a great point what you've made in terms of availability of dairy products. I also need to bring on board the former Agriculture Secretary, Mr. Siraj Hussain. Mr. Hussain, good evening to you. Thank you for joining us. What we're debating right now is that how exactly do you think the agriculture sector is prepared if lockdown is partially removed, and if highly affected states like Maharashtra, Tamil Nadu, and in the farm belt, if lockdown is not removed, do you think that's going to hurt the agriculture economy, especially the crop which is not completely harvested because of lockdown?
I think in Punjab, Haryana and UP, the harvesting is now going on, while in Madhya Pradesh, Gujarat and Rajasthan, harvesting is almost over. So local labor was used in Maharashtra, Gujarat, Rajasthan and Madhya Pradesh. And even though there is shortage of labor in Punjab and Haryana, but I think they will be able to complete their harvesting by using harvesters, mechanized harvesters, as well as the local labor. The real issue will come when the harvested crop is taken to mandis. So far, we have seen the procurement has started, but it has not reached, it is nowhere near the peak which should have been achieved by now. So I think the next few days will show how this challenge is going to be met in various mandis in Punjab, Haryana and UP.
Mr. Siraj Hussain, a lot of emphasis has been given to make sure that the Rabi harvesting is not disrupted. The central government, the state governments have come in. There's lifting, some restrictions from the 20th of April as well. But what is perhaps proving to be a huge challenge is transportation and getting the produce to the mandis and then getting the supply chain in place. What do you think needs to be done to ease that?
I think the government of India came out with very clear orders as early as 27th of March, when the Ministry of Home Affairs issued second addendum to its guidelines. However, what I have found, and my feedback is that in most of the places, the center's instructions were not followed by the district administration, the police, the district magistrates, etc. As a result of which, transportation bottlenecks continued to be there. And I think the reason was that the communication from the center was only restricted to Joint Secretary Health informing the country about what is happening to tackle coronavirus as a disease. in my view, what we are struggling with is not only a health problem, but also an economic, social, and sociological problem. So I thought the situation would have been much better if a press conference was taken every day by a senior minister, let us say the Home Minister, or if a minister was not available, then at least by Cabinet Secretary, so that the orders of the center were better understood by the district magistrates and the police officials who were putting all kinds of restrictions on transportation.
I want to bring Mayank Shah into the conversation. Mayank, great to have you on the show this evening. And I know in the initial weeks or so, Parle struggled a bit. Capacities were down to about 15%. First up, give us a sense of whether the situation has improved, what an extension of the lockdown really means for production, and what about distribution chains?
Well, so this was, unprecedented, and we had never seen this kind of situation in the past. So I think initially everybody, all industries, all companies were a little baffled. But I must say the way, government helped us out in terms of ensuring the food security, food safety of the country. In about a week's time, we were operational. Most of our plants were operational. Today, as we speak, we are at least about 35-40% of our capacity. And in terms of, availability is continuously improving. And I think, I would agree with most things that Mr. Sodhi said, that the demand has gone up. So while, you're still working with your 35-40% capacity, the demand has gone up. So for most of the times, whenever a consumer goes to a shop, or a grocery outlet or a retail outlet, he does not find, product. But that, to my mind, should be taken care of in next 1 week's time, because the production has gone down, the production has increased, the capacity utilization has increased manyfold, in last few days. So from about, as I said last time, 10-15% that we started about 1.5-2 weeks back, we are at about 35-40% plus of our capacity utilization. Hopefully in next week's time, you should see stocks, on the shelves. Even today, as we speak, it's not that the stocks are not available. At most probably they may not be available on a particular day, but the next day they are available. The pipeline is dry, as I think most people are, or most companies are saying. So there are two things. One, you have to fill up the pipelines. Plus, you have to also make it available. You have to cater or service to the increase in demand as well. So that's something that's happening. The kind of issues that we had initially are all getting resolved, right from working at the local level. So I've been in touch with government. I've had meeting with ministers and all, and they are equally concerned with the situation where food is not available on the shelves. So they're helping us out with everything. And going forward, I mean, we expect capacities to reach at least about 65-70% in next 1 to 2 weeks. Once that is, done, I think, you wouldn't have any problem in terms of having stocks on the shelf. But even as we speak, I can assure you that, there is no problem with the stocks. Maybe it may not be available on a particular day, but the next day they would be available. And as Mr. Sodhi rightly pointed out, the consumption has gone up. See, what typically happens is when you are at home, and you have kids, who are not going to school, typically, snacks like biscuits and other food items like that are consumed. The consumption goes up. You need to give them something or other to eat. And as a result of that, what happens is we've seen that people also tend to buy more. They tend to hoard. So the other day I was in market and I saw, I was there to buy some groceries, and I saw that, there was somebody who came and, he said, 5 packet Parle Ji ke dena, and the retailer said, 5 nahi, aap 2 leke jaiye, kal 2 aur main de dunga aapko, kal aake le jaiye. So a bit of rationing also is happening, I think. So, it's that way. I mean, he was asking for a 20 rupee Parle Ji, 5 packets of them. Now, typically, they buy 2 or 3 packets, or about a 1 packet of 20 rupee or 50 rupee or something like that. But that's also happening. Consumption is also going up, a bit of hoarding. Because he has seen the product which was not available yesterday, today available in the shop, he tends to buy a little more than what is required.
Fair point. Okay, I'm going to get one more comment from Mr. Sondhi. Mr. Sondhi, what is your experience telling you where the demand drop has been, where the demand drop could come back, and whether demand drop is normal? Because Amul deals not only with milk, they deal with value-added product, which in a sense capture the entire per capita curve in India. 45 days, it's been a learning for all of us, but it must be a consumer experience which you are analyzing at Amul. What has changed for Amul temporarily? What has changed for Amul permanently? And what has not changed for Amul at all?
Well, what has not changed, let me answer first, not at all, is procurement of milk from 36 lakh farmers. In fact, our procurement has increased by 15% in the April because small players are not buying milk from the farmers. Other dairies are not buying, ice cream people are not buying. So our plants are running 15% more than what we used to in the last April. So that has not changed. Milk purchase is normal. Now, if you talk about product categories, like I was saying, product categories like besides the milk because of 10-12% down because of HoReCa segment, product categories like which are used in the home for recipe purpose, like ghee, butter, cheese, paneer, has increased by 15 to 50%. I mean, people are making more recipes at home. I mean, cooking pasta, cooking baked vegetables, cooking cheese toast, cooking lot of cheese kebab, paneer kebab. So that is happening. So consumption has that way increased. And we are producing more, supplying more. What has reduced drastically is, like I said, ice cream. It was 95% down, but every day it's picking up. Second, Amul cream, which is basically more used in the HoReCa segment, gone down by 70%. Beverages, the flavored milk, the shakes, the coffee, it had gone down more than 80%, but again now it has come up to the 50%. So like Mr. Mang said, people are consuming, only pipeline is empty. So naturally everybody is buying on priority, companies are also supplying on priority. What has other changes? Supply chain. There are a lot of changes happen. We had 3 types of distributor for a fresh product, for dairy products, and for frozen product like ice cream. Now, because ice cream infrastructure is lying idle, working capital, manpower, distributor, so we have told ice cream fellow also, you can handle milk also, you can handle dairy products also. So because window involved is only 2 to 6 hours. And the same distributor who was distributing butter ghee can't cater to all
once again, and Mr. Sundi, every time I talk to you on television, we talk about Amul products, and it's always a very appetizing conversation. I'm sure by the end of the show, both Tamanna and me will be hungry. But I'm going to throw this back to Mr. Hussain to understand the importance of the rural and the agrarian economy here. And Mr. Hussain, there is going to be a demand crunch. Agri-inflation may have come back in the short term, but demand ultimately will play a large role, and agri-income is not going to be there. Do you think it makes perfect sense to increase MSPs? It's a touchy topic. It's a topic which, in a sense, has worked in the past to support the farm income and support the agri-income. But do you think now MSPs, or good old MSPs, have to make a comeback at an increased price?
In a few weeks' time, the government will take a call on the MSP for Kharif crops. Due to shortage of labor in various parts of India, I think the state governments would have already submitted their demand to the Commission for Agriculture Cost and Prices, CACP, to increase the MSP by taking into account higher expenditure on labor cost. I think we will go by the government will go by the report of the CACP, and we should see an increase of just about 4 to 6%. I don't think very substantial increase is going to come. In any case, in 2018, Kharif 2018, before the general elections, the government had revised the formula for fixation of MSP, and now it is fixed at 50% over A2 plus FL cost, at least. So I do not think that MSP for Kharif crops are going to see a very substantial increase, but also, I do not think that there will be a very low increase of 1 or 2%. So 4 to 6% increase is what I see for Kharif crops.
I just want to touch upon one issue very quickly, both with Mr. Sodhi and Mr. Shah, which is the shortage of labor. Now, this is across industry, across sectors and across businesses. And it's tied in very closely to the sort of mass migration we saw in the beginning of the lockdown. We might see a large number of people want to move once the lockdown lifts, and we'll have to wait and see what happens post 3rd May. But Mr. Shah, let me come to you with this question, and across the board really. Will it be now a big challenge to bring back labor forces who may have gone to their hometowns and villages during the lockdown, or may want to travel there once this lifts?
Well, I feel, that's going to be a challenge, definitely. But, it would probably differ from industry to industry. There are certain industries where this migrant labor is more on contractual basis. I think it would be a bigger challenge there. With us, as a company, most of the people who are working for us are on our rolls. And the kind of security that provides, that a job, being on a company roll provides to them is immense. So, yes, I understand there would be some who would have, probably gone today to their native places to be safe and secure. But eventually they would come back. They have a bigger motivation to come back because they have a short job. They have perks which, they probably would not get if they are going to some, unorganized segment company, or if they are working as a contractual labor. So that, to my mind, is a big motivation for them to come back. And we are hopeful that, they would come back as a result of that.
Mr. Sodhi, your take on this challenge of labor, and what companies like yourself can do to maybe increase the number of people you now hire, bring them back safely, and make sure that there is social distancing put in place.
Yeah, Tamanna ji, in labor front there are two issues. One is the shortage of labor. Second is maintaining social distancing in the plant. So what we have found, shortage of labor is mainly in the bigger metro cities. Like we have got plants in Bombay, Delhi or Calcutta. There we have faced. But fortunately, most of the dairy plants are smaller places and where labor is from around. So there that is not problem. But what has happened in Bombay, Delhi also, where labor has reduced, fortunately or unfortunately, that there are certain lines like ice cream are not fully utilized. So that labor has been shifted to the other value-added product side. But bigger problem is maintaining social distancing inside the plant. As far as the main processing is concerned, that is automated. But if you see the packaging line or the loading, there are a lot of labor involved, and it is extremely difficult to manage the social distancing. So there we have to see the number of lines to be increased. So few people are standing on one line. So you have to work at lesser speed. So you work all the 3 shifts, you work at the more packaging line, but with the lesser speed, so you can maintain the production and the demand. But I think gradually labor is coming back, and that problem will be sorted out. But problem of labor may be more in the construction industry and also in the metro like Bombay. The big problem is there for labor. There is a organized labor called Mathadi workers in Bombay. They neither they themselves come nor they allow other labor to come. So there we are facing problem, but not at the other place.
Absolutely. Bringing the labor back to the big cities, assuring them, many of them have felt abandoned and suddenly lost when the lockdown came into play, especially in the unorganized sector. I'm not talking about large companies, they managed to take care of their own. But we saw that in the mass movement of people who are right now sitting and wondering what comes next. Remember, this is the fuel that runs our cities as well. So we will have to look at this carefully. Before we wrap this mega broadcast, and of course, I want to thank Mr. Sodhi, Mr. Shah and Mr. Hussain for joining us on the last leg of this. Let us just take our viewers through the key findings of this broadcast and this research and what it has told us. The top takeaways include looking at a range in India of a peak between 30,000 cases to nearly 2.8 lakh cases. 2.8 lakh cases would be the worst case scenario. We are looking possibly at about 70,000 odd cases by the 16th of May. So what this tells us that even after the 3rd of May, it's not like COVID-19 cases will stop occurring or it will all disappear. We are likely to see, or possibly we can see, a steady rise in cases. What will be important is how we deal with it. The closing date of the entire pandemic in India could be towards the last week of August 2020. Some states may come out of it in the later part of May, and of course we are seeing a different position in different states right now, later part of May to early June for some states. For other states it might be even 1 month after that, that is the highly infected states might take longer. The only way to eradicate the pandemic is a robust lockdown for a substantial period of time. We have to be especially careful once the lockdown lifts so that there isn't a rebound of numbers, which is why the next steps will be very, very carefully plotted out, and we will have to see what happens. The medical infrastructure is also under question. In a worst case scenario, we may have a shortage of ICU beds, and that is something all states and policymakers have to prepare for. These are the broad findings. It gives us a sense that we're in this for the long haul. We need to tighten our belts, and we have to remember to grit our teeth through this. The lockdown is necessary. Social distancing is not a choice, it is a survival tool, and we're in it all together. With that, I want to thank all of you for joining us on this mega broadcast on ET Now.